Grief, a natural human response to loss, is a universal experience that touches us all. It's a complex and multifaceted emotion, often accompanied by a roller coaster of feelings like sadness, anger, guilt, and yearning. We usually think of grief as a temporary state, something we move through with time. However, for some, the intensity and duration of grief can become debilitating, extending far beyond what is considered a normal grieving period. This is where we begin to understand prolonged grief disorder. In 2022, prolonged grief disorder, or PGD, was officially recognized as a distinct mental health condition in the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM-5-TR. This recognition marked a significant step forward in acknowledging the profound impact of prolonged grief and the need for specialized treatment. PGD affects a significant portion of the bereaved population, estimated to be around 7 to 10% of adults who experience the death of a loved one. Understanding PGD involves recognizing that grief, while a natural process, can sometimes morph into a chronic condition that requires attention and care. Just as we would seek help for a physical ailment, it's crucial to extend the same compassion and understanding to our mental well-being, especially in the face of profound loss. This essay will delve into the intricacies of PGD, exploring its symptoms, causes, and available treatments. By shedding light on this often misunderstood condition, we hope to foster empathy, reduce stigma, and empower individuals and their support systems to navigate the complexities of grief with greater awareness and resilience. Prolonged grief disorder, or PGD, is not merely an extension of normal grief. It is a distinct mental health condition characterized by intense and persistent yearning for the deceased, accompanied by a range of debilitating symptoms. While grief is a natural part of life, PGD sets itself apart through its severity and duration, significantly impacting an individual's daily functioning and overall well-being. Imagine a grief so profound that it permeates every aspect of your life, making it difficult to engage in work, maintain relationships, or find joy in once pleasurable activities. This is the reality for those living with PGD, where the pain of loss remains raw and all-consuming, casting a long shadow over their present and future. The diagnosis of PGD is typically considered after a significant period of time has passed since the loss, usually at least 12 months for adults. This extended time frame helps differentiate PGD from normal grief, which, while painful, tends to gradually lessen in intensity over time. In contrast, individuals with PGD may experience little to no improvement in their symptoms, remaining trapped in a cycle of intense longing and emotional distress. It's important to note that PGD is not a sign of weakness or an inability to cope. It is a complex condition influenced by a multitude of factors, including the nature of the loss, the individual's personality and coping mechanisms, and the presence of social support. Understanding PGD requires a compassionate lens that recognizes the profound impact of loss on the human psyche and the very real struggles faced by those living with this condition. The symptoms of prolonged grief disorder are varied and can manifest differently from person to person. However, some common threads weave through the experiences of those with PGD, painting a picture of profound emotional pain and disruption. One of the hallmark symptoms is an intense and persistent yearning or longing for the deceased. This longing can be all-consuming, making it difficult to focus on anything else or find solace in other relationships or activities. Accompanying this yearning is a wave of intense emotional pain, often triggered by reminders of the deceased or thoughts of a future without them. This pain can manifest as overwhelming sadness, guilt, anger, or a combination of these emotions. The individual may also experience difficulty accepting the reality of the loss, clinging to the hope that their loved one will return, or feeling a sense of disbelief that they are truly gone. PGD can also significantly impact a person's sense of self and their place in the world. They may struggle with feelings of emptiness, purposelessness, or a belief that life is meaningless without their loved one. This can lead to social withdrawal, loss of interest in previously enjoyed activities, and difficulty engaging in future plans. Furthermore, individuals with PGD often experience intrusive thoughts and memories related to the loss, sometimes in the form of flashbacks or nightmares. These distressing intrusions can make it difficult to escape the cycle of grief and can contribute to feelings of anxiety, fear, and hypervigilance. While the pain of grief is universal, prolonged grief disorder, or PGD, stands apart from normal grief in its intensity, duration, and the level of impairment it causes in daily life. Normal grief, while deeply painful, is a natural and adaptive response to loss that gradually lessens over time. It's characterized by waves of sadness, longing, and other difficult emotions, but these waves tend to become less frequent and intense as time passes, allowing the individual to gradually heal and adapt to life without their loved one. In contrast, PGD is characterized by a persistent and debilitating grief response that does not significantly improve with time. The intensity of the grief remains high, often feeling as raw and overwhelming as it did in the immediate aftermath of the loss. This unrelenting grief can make it difficult to engage in daily activities, maintain relationships, or find joy in life. Another key distinction lies in the level of functional impairment. While normal grief can temporarily disrupt daily routines and responsibilities, individuals typically find ways to gradually resume their lives and adapt to their new normal. However, PGD significantly impairs an individual's ability to function in various domains of life. Work, school, social activities, and even basic self-care can become overwhelming challenges, as the individual remains consumed by their grief. Furthermore, PGD often involves a preoccupation with the deceased that extends beyond normal grief reactions. Individuals may experience intrusive thoughts, images, or memories of their loved one, making it difficult to focus on anything else. They may also engage in excessive avoidance behaviors, such as avoiding places, objects, or activities that remind them of their loss, further isolating themselves and hindering their ability to heal. Section 5. Risk factors and vulnerability. Who is more susceptible to PGD? While grief affects everyone differently, certain factors can increase an individual's vulnerability to developing prolonged grief disorder. Understanding these risk factors is crucial for identifying those who may benefit from early intervention and support. One significant risk factor is the nature of the loss itself. Sudden, unexpected, or traumatic deaths, such as those resulting from accidents, homicides, or suicides, can significantly increase the risk of PGD. The shock and lack of closure associated with these types of losses can make it more challenging to process the grief and adapt to life without the deceased. The individual's pre-existing mental health also plays a role. Those with a history of anxiety disorders, depression, or other mental health conditions may be more susceptible to developing PGD following a loss. This is because pre-existing mental health challenges can exacerbate grief reactions and make it more difficult to cope with the emotional pain. Social support networks also play a crucial role in mitigating grief. Individuals with limited social support, such as those who are socially isolated, have strained family relationships, or lack close friends, are at an increased risk of developing PGD. This is because strong social connections provide a buffer against the isolating effects of grief, offering emotional support, practical assistance, and a sense of belonging during difficult times. Section 6. Navigating the labyrinth of loss-effective treatments for PGD. While the experience of prolonged grief disorder, or PGD, can be incredibly isolating and painful, effective treatments are available to help individuals navigate their grief and begin the journey toward healing. These treatments aim to alleviate the intensity of grief symptoms, improve coping mechanisms, and foster a sense of hope and resilience in the face of loss. One such treatment is complicated grief therapy, known as CGT, a specialized form of therapy specifically designed to address the unique challenges of PGD. CGT focuses on helping individuals process their grief reactions, reduce avoidance behaviors, and gradually re-engage in meaningful activities and relationships. This type of therapy often involves revisiting memories of the deceased, exploring the meaning of the loss, and developing coping strategies for managing intense emotions. Cognitive behavioral therapy, or CBT, is another effective treatment approach for PGD. CBT focuses on identifying and challenging negative thought patterns and behaviors that contribute to and maintain the cycle of grief. Through CBT, individuals learn to reframe their thoughts, develop healthier coping mechanisms, and gradually increase their engagement in activities that bring them joy and purpose. In addition to therapy, medication may also be considered as part of a comprehensive treatment plan for PGD. Antidepressants, particularly selective serotonin reuptake inhibitors or SSRIs, have shown promise in reducing the severity of grief symptoms, such as sadness, anxiety, and sleep disturbances. However, medication is typically used in conjunction with therapy to address the underlying emotional and behavioral components of PGD. Section 7. The physical and mental impacts of grief, a holistic perspective. Grief, while primarily understood as an emotional experience, also has profound physical and mental health implications. The intense stress and emotional turmoil associated with grief, particularly in the context of prolonged grief disorder or PGD, can take a toll on the body, increasing the risk of various health problems. One of the most significant impacts of grief is on the immune system. Studies have shown that bereavement can suppress immune function, making individuals more susceptible to infections and illnesses. This is because the stress hormones released during grief, such as cortisol, can interfere with the body's natural defenses. Grief can also disrupt sleep patterns, leading to insomnia, nightmares, and other sleep disturbances. Lack of sleep further exacerbates the physical and emotional toll of grief, making it more difficult to cope with stress, regulate emotions, and engage in restorative activities. Furthermore, grief can manifest in physical symptoms such as fatigue, headaches, muscle tension, and digestive problems. These physical manifestations of grief can further impact daily functioning and overall well-being, creating a vicious cycle where physical and emotional distress feed into each other. Section 8. Coping with loss strategies for healing and finding resilience. Coping with loss is a deeply personal journey, and what works for one person may not work for another. However, there are some general strategies that can help individuals navigate the grieving process, find solace in difficult times, and cultivate resilience in the face of adversity. One of the most important things you can do for yourself while grieving is to allow yourself to feel your emotions. Grief is a natural and necessary process, and trying to suppress or deny your feelings will only prolong the healing process. Allow yourself to cry, to be angry, to feel sadness, and to express your emotions in healthy and constructive ways. Seeking support from others is also crucial. Talking to friends, family members, or a therapist can provide a safe space to process your emotions, gain perspective, and receive much-needed emotional support. Joining a support group can also be beneficial, as it allows you to connect with others who understand what you're going through. Engaging in self-care activities is essential for both your physical and emotional well-being. Make sure you're eating healthy foods, getting enough sleep, and engaging in regular physical activity. Even gentle exercise, such as walking or yoga, can help to reduce stress, improve mood, and promote overall well-being. Section 9. Supporting grieving individuals, a guide for empathy and practical help. Supporting a grieving friend, family member, or colleague can feel daunting, particularly if you've never experienced a significant loss yourself. However, even small gestures of kindness and understanding can make a world of difference to someone who is grieving. One of the most important things you can do is simply to listen. Let the grieving person know that you're there for them and that you're willing to listen without judgment. Don't feel pressured to offer advice or solutions. Sometimes the most helpful thing you can do is simply to be a compassionate and understanding presence. Avoid making statements that minimize or dismiss the person's grief, such as "time heals all wounds" or "they wouldn't want you to be sad." Instead, acknowledge the depth of their loss and validate their feelings. Let them know that it's okay to feel sad, angry, or confused, and that there is no right or wrong way to grieve. Offer practical help whenever possible. This could involve assisting with errands, cooking meals, or simply being there to listen. Small gestures of kindness can go a long way in showing your support and letting the grieving person know that they are not alone. Be patient and understanding. Grief is a process, and there will be good days and bad days. Don't expect the grieving person to snap out of it or to be back to their usual selves overnight. Continue to offer your support and understanding over time, even if it seems like they're not ready to accept it yet.